Live from the Piedmont News Channel, this is the Fox 8 Morning News at 7.
Well, because it's Halloween and you're thinking about candy, it's probably a good time to remind you about the importance of oral health. Dr. Stephen Brattesani is a member of the American Dental Association and joins us live this morning. Good morning.
Good morning, Sydney. It's great to be here in Greensboro with you.
Well, you know, my children were saying to me yesterday, boy, I bet the dentist hates Halloween. And I said, maybe it's the orthodontist more than the dentist at this point.
No,
but
we really like it.
You really like it?
Yeah, we do. Because it gives us a chance to be with our families as well.
Hey, let's talk a little bit about oral health.
Sure.
You know, some reports say that there is an oral health epidemic in the United States. What is meant by that?
Well, I think it was coined by David Satcher, former Surgeon General of the United States, and basically it's about cavities. Kids are being affected by the amount of sugar that they eat. I think the latest report is 65 pounds of sugar a year is consumed by the average American kid.
Wow. And a lot of times, you know, kids will brush their teeth before bed and then grab a snack and they're going to bed with that sugar on their teeth, right?
Yes, absolutely. You are correct. It's one of the pet peeves out there.
So what can we as parents do to help combat this, and not only in our children but in ourselves, because we, you know, adults have dental problems as well?
Right, absolutely. In fact, it's at the beginning when you're a young kid that makes the difference, because a lot of the disease process that start early on can lead to things such as diabetes and heart disease. So we really want to make sure that the children understand that they need to take care of themselves. And as a parent, as a dentist, I've searched for a lot of different ways to make my kids be more compliant with what they're doing. And one of the things I've learned is when you make it fun, the kids really want to do it. So for example, I found a product out there called the FireFly, and it's basically a little lighted toothbrush that lights up and actually times the child and lets them know that they're brushing long enough for 1 minute for the upper recommended and 1 minute for the lower. And so this is one of the neat ways that children make it a fun game, and my little girl Mirella loves it. She just adores this. One of the other things that I found out there is another product, and you know, mouthwashes are for adults, so you think of fresh breath, but for children what we're doing is we're eliminating a lot of the fluoride in the water when we give them bottled water, because we're trying to give them better water products. Well, the issue is we're taking the fluoride out. So this allows us to give them a little cap that you swish for 30 seconds, and it's enough treatment for the fluoride to get into their teeth. So it allows us to really make a difference. And a few other things that we can do is, for example, change a toothbrush every 3 months or so. Make sure that the toothbrush is dry in between uses. And another thing that parents can do as a game, again, with children is make a little compliance chart in the bathroom that allows them to kind of fill out as they brush their teeth, so that at the end of the month cycle or whatever, you can reward them.
Twice a day.
Twice a day, floss, brush, and rinse.
Now, you've got a lot of goodies here in front of you.
Absolutely.
Being realistic about Halloween, there's absolutely no way to keep kids away from candy.
There's no way to keep them away from it. And it's okay, as long as they take care of what they've eaten and they brush and floss and rinse properly, it's all right. We don't want to stop the candy industry. As dentists, we like the candy industry. But I have to tell you, they're not going to stop eating the candy. We just want to make sure that we get good oral habits, good oral hygiene, and as well as diet. We want to make sure. But, you know, it's not just the candy that makes a difference.
Right.
It's even the healthy foods, such as raisins and good fruits and things that have the hidden sugars in them. So we really want to start early and insist upon them to make sure that they brush and clean their teeth. One of the things that I want to mention as a parent and my wife also, when you're teaching your kids to brush, you never want to use your toothbrush and actually place it in their mouth, because we could spread disease processes from ourselves to their children.
Ooh. That would not be good. That's a great thought. All right, hey, thank you so much for joining us. We certainly appreciate it.
You have a great day. Thank you very much. Bye-bye.
Bye-bye.